my background is I'm a prosthodontist. And I'm a dentist first, of course, and foremost, but I went to some extra training and basically started going through some things and sort of became a, if you will, a professional student for a while. But originally, let me see if I can get my slides to transition here. There we go. I'm originally from Canada, and I'm a farm boy from Saskatchewan. Went to dental school in Saskatchewan. If you didn't even say that, or you know where that is, but it's the prairies of Canada. It's the oil country and grain country, and I really wanted to learn more, not necessarily so I could call myself a prosthodontist or this or that, but I really wanted to learn more and advance things that I felt like I didn't really learn in dental school. So then I went to San Antonio, where I thought I got a great education, some great opportunities, and finished my diploma in prosthodontics, and did a master's in biomaterials and prosthodontics, and stayed around, did a fellowship in oral surgery so that I could really do some things. Then spent some time in New York with Ivoclar Vivadent, and ultimately decided that I'm a dentist, I need to be in clinical practice, and that's where I am. And happily living in a nice warm climate down here in Houston, Texas, and enjoying no snow, and I can live without snow. So I'll give you a little bit of my experience and different things, but Houston's been a great place. It's a big city. There's a lot of opportunity here, not only from the oil world, but from just things that are available for patients with, money to spend money on dentistry, and it's been a great place for me. I show this picture of us doing some work clinically, but I am a wet finger dentist, and everything I do and everything I'm going to talk about is in relationship to, what we do every day. I think everybody on this call is pretty much a clinical dentist, and, we definitely and absolutely are working day to day, working on patients, finding out what works, what makes our life happy, what makes us happy, and things that we can actually improve people's lives and make a nice income doing it. I told you about my time with Ivoclar. I was able to meet a lot of different people at that time and see what people were teaching and what they were thinking, and got some time to spend with LVI and Pac Live and Hornbrook, and lectured a little bit with Dr. Hornbrook and taught with those guys for a while, a couple of years, and ultimately with the Aesthetic Masters in Las Vegas. So I've got to see what education is all about and how dentists think and how we look at things and how we evaluate things and what's going to work in our hands and what isn't. I'll tell you, find a great lab and you can do great dentistry. There's these patients that come in and they, the world of I want veneers and all this different stuff, it's kind of changed obviously over time. And, before we put things on teeth like this, we want them to be successful, and we better analyze the patient and find out what's going to make them successful. We know that, looking at a patient like this, they don't really think their smile's bad. They don't realize all the destruction that's happening, but they have relatively straight line teeth. They're relatively, sort of tooth-colored white, and they're not really doing that. But they may show up with other things, and we have to ask them, there's a lot of destruction on your teeth. What are you doing? Why is this happening? Why have you spent so much money on kind of a crown here and a crown there, and with all these worn teeth in the front, and what's going on? And they might start opening, a can of worms that says, oh yeah, I've got all this muscle pain, I grind my teeth, I'm doing this, I'm doing that. Or they might not even recognize that they have these problems. But before we start putting on these amazing pieces of glass on the front of the teeth and expect them to work, we better get to the heart of the problem and find out what's really going on with a lot of these patients. I laugh at this, and I show this picture because I go, how many central incisors does this person really have? And I laugh because, as you know, that tooth over there on the side is what was a canine. It's supposed to be pointy, isn't it? Canine rise. But I ask a lot of dentists when I'm lecturing, I say to them, what is the cause of this kind of wear on people's teeth? And a lot of dentists will say, oh, they grind their teeth, they do this, whatever it is. But they really don't know what the cause is. And if you look at the literature and you look at what's happening clinical in a lot of these people, they're avoiders. They're moving away from interferences. They're using their muscles to hold their bite in a position, obviously self-equilibrating themselves and grinding into a position. So this canine was, pointy at one time. It's worn now to get out of the way, basically. The patient has destroyed it. Probably and most likely because there's a balancing interference on the contralateral side, leading to this person posturing over and wearing this tooth. And a lot of dentists can't even describe that problem, but they go ahead, put on glass like this, and they wonder why things start to fall apart. Or they put on glass like this, trap the patient into a position, and all of a sudden the muscles flare and the pain starts with the patient. As I mentioned before, do patients really realize what the problem is? Do they actually see that, their lower incisor typically should be 8 to 9 millimeters long? These clinically measured about 6 millimeters. So that's about 2 to 3 millimeters of every tooth gone on those lower incisors. So if you look at just the lower 6, you can tell the patient, do you know you've lost about 12 millimeters of tooth here? That's more than one of these whole central incisors. And what's happening? I don't want to put a bunch of beautiful veneers on the front of your teeth here and then you just break them off or wear them off. So you need to get to the heart of the problem. Once you start asking patients about how they feel, how their muscles feel, then you can find out, is there something that needs to be done? Do they have underlying problems? There's a lot that goes into this. So that's just one element. I always put this picture in my lectures and I laugh because it's quite frankly, it makes me think about, as dentists, what are we doing? Some dentist somewhere put that lateral crown in there, that white one, and took a step back and said, it's great, let's go with it. You know, all this destruction of the lower teeth, all the destruction of the upper teeth, this white crown was put into this guy's mouth with great abrasive porcelain on it to make things even worse. But, you know, this is probably the patient that said, make it a little whiter, I want to bleach. You know, you've seen those patients before. Or they just wanted a little lighter. For whatever reason, that was what happened to this patient. And so, but they had lots of other problems. This patient presented with lots of joint problems, lots of muscle problems, lots of overworking, buttressing bone, and wanted something stable and just wanted to stop, you know, having all these problems. This is an older fellow, you know, having years of destruction of teeth and fixing teeth piecemeal and not real happy with it and not real secure. And, you know, you can make them look great and better, but it's basically there. Another fellow, you know, huge destruction, sore muscles, sore pain, sore everything going on. And really not making a relationship to any muscle soreness that he had and any of the parafunctional activities that he had and the teeth, not putting all that together. So once the teeth are properly restored and realigned, you can actually fix some of that. Not all of it, but fix a lot of it. So again, just showing some cases here of some different people and some of the destruction that they have and some of the related things that we see every day in clinical practice. This fellow here came in and was, you know, chief complaint was, he thought his smile looked great, but lots of soreness and lots of pain in his muscles. Well, obviously he's worn his teeth in the anterior, and I always laugh and I say, you know, we use these circles in your teeth to tell how old you are, and you know, like the lines in a tree. But patients giggle at that, but then they realize, wow, I've lost a lot of tooth structure here, and what's going on? So I want to work through them and see if there's any related things, you know, going on with them before we do that. And again, you know, showing him, I said, I want you to look like you're happy and so excited about your teeth. And I think he looked just a little freaked out a little bit, just to have a little fun with him, but he was a great guy. So tonight I get an opportunity to talk about something. I don't work for the TruDenta company. The TruDenta system is something I'm going to talk about and give you an idea of how it's fit into my office, why I liked it, what's been good, what's been bad, what's been challenging, what's been a positive factor. So I call it something very cool, obviously, and TruDenta, I've got their nice slide background for you tonight. So there's going to be some questions, and hopefully I'll answer everything about what it is. But what was my goal when I talked about getting into TruDenta? And it was really wanted something in my office, and I was looking for something in my office that would be a new source of revenue and a new source for patients, basically. And this is what one of our goals is. It doesn't matter whether it's implants or what it is in your office. We're always looking for something that will bring us that source of revenue, which comes with a source of patients. And so, you know, a lot of us have option to, you know, go down the insurance road, and we give that 20% up to the insurance company because they market the patients for us. So they bring those ones in, and there's a give and take there. But I want to find something that was just brand new and something for my office. And I think that was great. You know, how I had to evaluate what I needed was I needed to look at the areas I wasn't doing a good job in my office. I really need to see some things I really enjoy, which I think I do a better job at, and some things I really needed to get. And one of the areas that I felt like I fell into this rut was treating TMD, MMD patients, musculomasculatory disorders, temporomandibular disorders, and just the pain patient. Patients that came in and said, you know, they don't even make the relationship of their worn teeth to the sore muscles that they have. And they're kind of at the end road where they've gone to a doctor, they've gone to this person, and they've just got these pain in the muscles constantly. I'm going to show you an young attorney that just made major complaints to us. But these patients are out there, and they were kind of in this one window for me that, okay, these patients all come in, if they have sore muscles, they have sore joints, whatever it may be, they're kind of all the same kind of patient. And that's where I got into my rut. You know, with my clinical training and the training I went to after dental school, I felt like I had an amazing ability to, you know, write down all the signs and symptoms, all the things I could see, all the things that the patient was telling me, all the things that the patients were aware of. But honestly, I got to a point where it didn't matter, because if they had one or two of these things, they were all going to get kind of treated in the same way. I had some great people, some amazing people teaching me I had some of the people that wrote the books basically on this kind of stuff of treating patients with, muscle pain and headache problems and whatever you want to call it. I really fell into a rut, even though I had all these great teachers. So there was guys in town that had, they were so-called the TMJ experts. And I almost felt like, geez, I need to start sending those patients away, because if I misdiagnosed some of these patients and they really were patients that had headache problems and pain problems related to, let's say, chemical imbalances, or the migraine that's related to an allergy or an environmental thing, and I misdiagnosed that, I'd be married to these people. And what I mean by that is I'd become their their psychotherapist, and I'd be seeing them so much, and guess what? We're not making any money. And quite frankly, I was getting into the rut where they'd all get the same splint, they'd all get the same kind of thing, and I fell into that whole thing that a lot of us do. So again, when it came back to these patients coming in my office, and they were being referred to me sometimes, the headache patient, the face pain patient, I call them, the team, all these people, what do I do? Do I treat or refer? And you know why I was thinking more about referring even to people that I felt like weren't doing much more than I was? Because I didn't know how to make money. I know how to charge right away for the first part, but I didn't know how to put it all together to make any money. And one of the challenges was I couldn't figure out really what was upsetting the system, meaning every patient is unique. And there are 4 or 5 different kind of broad groups that patients fall into, but I was just falling them into all the same. And then obviously my treatment outcomes when I was using these different appliances and different things and long term, and really I was giving them a piece of plastic to wear for the rest of their lives between their teeth, because I felt like keeping the teeth apart or keeping the teeth in some other mechanism was the way to go, and that was a disaster. So that was where I needed to go. And so when I really evaluated my office and what I needed, I know about the revenue, I know about the patients, but I needed something to diagnose the patient. If you can't diagnose the patient, you can't treat the patient. And ultimately, if I'm going to do the treatment and start working on these kinds of patients, I better not find ones that I can't treat. I better find ones that are dentally related, so that diagnosis is huge. And I better be making some money. Otherwise, what are we going to work for? I mean, this is our job, and it's the way we make our income. So what I needed was TruDenta. And up until a couple of years ago, it really wasn't around where somebody put together a system that was based on solid principles that I could actually implement into my office and treat these patients according to what they needed, not what I just felt like they should get. And that was a big deal to me. So what is TruDenta? Well, if you look at what the company says, it's a system for combining physical medicine rehabilitation with force management dentistry. And I go, holy cow, what is that? I kind of just look at it, but what it really is, and the way I describe it, is it brings medical and dental together. It is a bunch of factors from medical, which are well within the scope of dentistry, which are some therapeutic approaches like physical therapy and some of the other things that they use in medical. And it's dental things where we look at force balance and force management. And it's interesting when you look at this, because the medical people can do all the medical stuff, but they can't do the dentistry. The dental people can do all the dentistry, and they can do all the medical stuff. So it's a perfect marriage for something that we're trying to do. We just didn't have all the pieces in dentistry. So bringing in some of these medical things really, really helps. So really, to describe it better in my hands, it's a treatment for patients with, temporomandibular disorders, muscle mastication disorders, associated headaches, or commonly referred to, as I call them, the physical migraine condition. Migraines fall into a couple different categories, actually 3 or 4, where one is, it's a chemical imbalance. You better not start treating those ones, because you're not going to get anywhere as a dentist with those ones. There's ones that are environmental, which really should be on the medical side only. And then there's ones that are this physical, physical factors that are conditioning these migraines. And migraines are basically any kind of headache that lasts, is 14 times a month and lasts a period of time. It doesn't have to be auras all the time. There's a lot that goes into that definition. So I really need to figure out what the heck this was. It's a treatment for these patients that have all these problems or related headaches, whether they make the relationship to their bite or not. And some of them will just say migraines. A lot of people don't think dentists have anything to do with migraines, but the physical triggered migraines, we can do a lot. We diagnose this. I know we learned this in dental school. We learned to palpate muscles and find out which muscles are sore and which ones aren't, and mobility of these muscles and the different muscles in the head and neck region. But what do we do with that? No one ever told us what to do when we find the sore muscle. So finally, there's a system, and I'll explain this, that will actually help us to relieve some of these muscle aches and pains and related trigger point issues that we can actually work out for a patient and make them feel much better. So when you look at the TruDenta system and what it can do, it's definitely something we do in our office. It has an element that the patient will do away from the office, which we call the home care system. And then there's something that we're going to use in not only TruDenta, but in almost every element of our dentistry, the force management. And I'll explain more about that as we go through. So this guy shows up at the office. And he's a young attorney. And you can see here he's done some really, really significant destruction to his teeth. And his complaint to me wasn't even necessarily that he had anything wrong with his smile. He complained that he was just simply tired of popping Advil all day long, every day. And I said, well, why do you do that? Of course, why? Because when he wakes up in the morning, he's got a headache. In the middle of the afternoon, he's got a headache. All day long, he has a headache. And, here's an example. If you don't believe that a postural position can cause you pain in your muscles, for the rest of this presentation, I want you to hold your teeth end to end, just where you put the edges like you're biting through a sandwich, end to end. And see how long you can do that before your muscles actually give you pain. Somebody historically in this person's life actually went in and put gold crowns on the back. Why? Because this guy's been destroying everything, trying to find an equilibrium where his muscles don't have to fire so much to hold the bite in place. So they put gold crowns. Why would they put gold crowns on a young guy like this? Why? Because he destroyed all the porcelain that he had in there. Because everything was an interference. And we're pretty darn good as dentists at putting iatrogenic interferences in. So, before we put glass, put a person into a locked position that they potentially could just destroy, we better get to the heart of the problem, classify this patient into what really is happening for them, and then we can consider, restorative practices and get him back into a position that he wants to be. So, dentistry looks nice, everything looks wonderful, but there's these patients out there that really don't know that the dentist is the place to go for a lot of their head and neck muscle pain. And they don't see a link between, because they look in the mirror, they got those nice worn out flat across the teeth, they're not too dark, they're not too yellow, they look like they have a nice smile. They don't make a relationship into what we can do and that the dentist actually can help. So there's a lot of patients out there. So when I started digging into this, I wanted to look at patients and say, I showed a picture of this person before, just one picture. This is 4 different ones. And there's a reason for that. There are patients with all different kinds of problems that can relate to this head and neck muscle pain patient, grinding patient, Bruxer patient, migraine, whatever you want to call it. And we needed to figure out a system in dentistry that we can actually treat these patients because no one else is doing it like we can do it. So when I looked into the history and the background, I wanted to make sure I was going to look at a system that was really going to treat something that was in the scope of dentistry. The great thing, and I'll explain how it does it, but one of the great things that TruDenta does is it weeds out those patients that really have a chemical imbalance, that have headaches or migraines related to a chemical imbalance. And so we don't want to get involved with those. Those are the ones who become their psychotherapists, as I was mentioning before. But if you look at this slide, and this is some information that just kind of blew me away. There's 100 million people out there that suffer from headaches. About 37% of those, or 37 million of those, have migraines. So let's say that migraine is the type of headache where it has to go to the physicians. Well, that leaves a lot of patients out there that are suffering from headaches from other physical problems, meaning they've got a skeletal problem, they've got a dental problem, and this is, the head and neck kind of migraine patient. So it's huge. And so there's patients out there that we haven't even looked at or told that we can help in dentistry because we're so busy drilling and filling. But, more women than men and some of the other things. Why? Because women will tell, I think, what's going on and will open up to those things more than a man. And I think that's just sort of human nature in a way. But more importantly on this slide is that 44.5 million adults suffer migraines. That's huge. That's huge numbers out there. And about $13 billion a year is lost in work days and due to headaches and migraines and due to just soreness. And, if a patient, looks at what they think a migraine is, do you have a headache? Does this happen more than 10 or 20 times a month or even more than 10 a month? It doesn't matter. They'll go, yeah, it happens all the time. Remember that fellow that was popping the Motrin all the time? Every day, all day. He's just tired of doing it. Felt like it was hurting his system. And so they're out there. These patients are out there and they're coping. So the other thing is interesting. They'll spend about $1,000 in a period, maybe up to $4,000 a year, these patients, or more, or much more in medical costs trying to solve their migraines. And if they truly have those chemical imbalances, those 37 million out of the 100 million, maybe they can be helped with medicine. But what about all the ones that have the physical problem that dentistry can definitely help? That can definitely help for those head and neck type pain headaches. So we know what causes headaches. We know that there's history of things that are red flags to us, microtrauma, macro trauma, stress in your system, just putting a little bit of life into your day. And we see people that are having changes in their life. They get married, they have kids, they have all the things. There's lots that goes into some of these trauma type things. Also, we are very busy in sports and different things and causing trauma. We're very busy running into each other and doing some crazy things on our own that can create trauma in the head and neck region that can definitely lead to types of patients that are TruDenta. So here's that attorney, young guy, doesn't think his smile's so bad, but popping Motrin all the time, just going crazy on this, and wants to have something that's going to get rid of this. Well, when you start relating to what he's doing dentally, related to how he's posturing himself forward into this position, and saying, look, over time, if you remember, that we really, really have to put together some things. And we learned this in dental school. Remember that Krebs cycle thing that we had no idea of exactly what was going on with that whole thing in biochemistry? Well, guess what? When you overuse a muscle, and I showed those diagrams of the muscles before, when you overuse a muscle, the Krebs cycle is working. As a result, the little ADP that's formed for energy, ATP, all of the off products that are in order to create that energy, like bradykinins and all those different things, we call them lactic acid, are building up in those muscles. As a result, the muscles start to shut down. They don't want to work. There's not enough blood flow, and you get pain in those muscles. So to hold your jaw in this configuration is going to give you soreness over time. To self-equilibrate yourself, where you overuse the muscle, and as you overclose the muscle, the energy to overclose those muscles is much greater, more ATP formation, more bradykinins, more lactic acid, and more soreness. It's pretty clear. Some of those things should have been explained to us, I think, a little better in dental school. But it's there. So before we get there, we need to look at some basic dental principles. Does this person have an occlusion that can support muscles? Meaning when the teeth are together, the muscles should be relaxed. This bite is being held together by muscles. And the headaches that he has related is definitely related to what he's doing here. So there's balancing interferences. There's no canine guidance. There's none of the things that we look for. And every day, tomorrow when you go into the office, I want you to do a couple things. Just look for cracks in teeth. Look for cracks with stain. You know that a crack with stain means that it's all the way through the enamel. Look for range of motion. Most dentists, when I tell them, they don't even know what the range of motion should be for a person. Let's say for women it's 45 and for men it's 55. If a patient can't open up, then something's wrong. Have you ever delivered a crown, where put a crown in, you have the patient tap, 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 great. Put your teeth together, slide to the left. They slide to the left, no problem. Put your teeth together, slide to the right. Can't. What do? Take your gloves off, this adjustment's done. Well, that should be a huge red flag. That is everyday dentistry. There should be a red flag that patient is doing something in there, and you can help that patient. I'll explain how you do that. But postural positioning, self-equilibration related to overuse of muscles is the #1 cause of pain. And these patients will come in, and you can see here that we can definitely make this look a lot better. We can definitely improve a lot of different things for this patient. But there's some things we need to get to the heart of. If their chief complaint is they have soreness, they don't think their smile's that bad, you need to figure out why the soreness, and you can see some dental things that are not ideal here. Remember, this TruDenta is not a system. It's not neuromuscular. It's not a neuromuscular approach. It's not necessarily even a CR approach. But it's not also driving everything for a full mouth rehabilitation. It really isn't. I get very few full mouth rehabilitations from TruDenta. But when I explain what the system does in a minute here, exactly the steps, you'll understand how that fits. But this destruction needs to be noted. And it needs to be noted to the patient that something's going on here, that they're compensating for something being out of balance. The force management system needs to be taken care of. If it hasn't resulted in pain at this point, it's going to result in pain, so proactive nature to it as well. So, balancing interferences on the patient's upper left, that tooth is coming into contact way before anything else. Obviously, they rotate their jaw around that to bite on their front teeth, causing this wear and tear on the front teeth. And so it's there. This patient came in, severe neck pain, not all the time, very cyclic, severe masseter pain, and severe temporalis headaches, constantly taking a lot of Motrin, a lot of aspirin actually at that point too. That's what would help her. Didn't make any relationship to her teeth. And if you look there, there's some significant damage, and dentist after dentist has gone in here and done patchwork. Money necessarily wasn't even an issue for this patient. She just never got to the right person. So she's been fixed. She spent money on her teeth according to what dentists have told her to do, but she's in severe pain, so she made no reference. Breaking off teeth at the gum line, unless you're hit with something directly, you're doing some significant force here. And a lot of these patients will complain about soreness and pain and tension in there. And microtrauma definitely leads to other problems. You don't need me to explain this to you. You've seen things it can do in your practice with microtrauma, clenching, pulpitis of the teeth, needing endo, crushing the nerves at the end of the roots. You've seen all this stuff before. But in the long run, if we don't understand these sensory-motor dysfunction problems and related headaches and related to muscle pain and related where the teeth are coordinated with that, we're the ones that are going to pay for this. And if you just look down this list, I know that you've seen this in your practice, whether it's remakes or unproductive appointments or whatever it may be. This could have been treated as a comprehensive dentist looking at all these things. So I'm going to give you my breakdown of exactly what I think TruDenta is. I know the company has a way of doing this and the way they describe it, but I'm going to explain to the clinician how I feel this has fit into my practice and how I can treat patients. So patient comes in, whether they have really broken down teeth or not so broken down teeth. I see a lot of patients with this, orthodontics that's relapsed, and they come in with soreness in the muscles, just soreness. It goes down their neck, sometimes into their shoulder region. But the first thing you got to do is you have an interview with the patient. It's the first thing TruDenta does. It's got a very, very detailed, and I call it the weeding out system. So it's our weeding out, basically, not so much we call it an interview, but our weeding out appointment. And what I mean by that is this will go through a detailed analysis, and it's much more involved in this. Not only a questionnaire of the patient, but an interview with the patient, discussion that one of your staff does. And what happens in there is this will weed out those patients that actually have the chemical imbalances, environmental problems that are leading to their pain. Those are the ones that you don't want to get involved with. They're not dental-related problems. TruDenta does an amazing job in this phase of weeding out those patients so that you don't become married to them. You're not going to be seeing them for the rest of your life getting nowhere because the dental treatments will not fix those types of patients. Also included in the early steps are the tests. These are proprietary pieces of equipment that TruDenta has, which I think are phenomenal. And because in dentistry, I've never seen a way of actually looking at range of motion and having the patient go through a range of motion and directly relating to that to what the norms are. So I've always seen patients, I got sore neck, but I had no way of seeing just what was the limitation that the problems were occurring. So there's equipment that you'll get with the TruDenta system that will look at range of motions, how the patient fits in. As you go through therapies, which you'll see in a second how that works, you'll actually be able to go back and say, are you getting better or worse? Is something feeling better? Patients will tell you it's better this way, but it's not that. Maybe a little more work needs to be done somewhere. But it's amazing. They also use a system that's called a T-scan. It's been modified and optimized by TruDenta for what we're doing here. But you will utilize this in day-to-day, every day, not only in TruDenta, but you will utilize this force management. It's nothing more than electronic articulating tape that shows the force vectors of how the teeth come together. And so it's a thing that you put in the patient's mouth. They bite down, the screen comes up, and you can see exactly where the force is going. Here you can see on the range of the 14, 15, 16 range, there's huge contacts there. In fact, 85% of this person's bite is over there. I bet you this patient, if we saw a clinical picture of them, number 6 would be worn off like the one I showed you earlier in the presentation, because they have got a contralateral interference driving their jaw across, and a lot of times the only way they can do it is self-equilibrate themselves and move their jaw and hold their jaw in a space to avoid, and these are what we call avoiders. They avoid posterior interferences, and it's very difficult to see that with articulating tape without going through a process like this. So you really can see where TruDenta will help you to determine, can we adjust this patient, or is this an additive adjustment? Meaning equilibration is one of two ways. One, we take things away. 2, we do add-ons, meaning if they've lost some contact, put that back so they have their guidance. Eliminate something over here and put something back. So we'll talk about how TruDenta in a few minutes has increased our general restorative aspect of our office. It's amazing what it's done. Once you have diagnosed the patient, so you've weeded out the ones that are the chemical imbalances, then you've gone into the ones that you've looked at the range of motion, you looked at their forces, you looked at all the equipment type diagnostic stuff. If there's one thing, if all I had from TruDenta was the diagnostic components that would then go into this classification, that's all I'd need. But they've gone one step further. You diagnose the patient, and now you're going to classify that patient. And remember those 4 different pictures I showed you? This has been phenomenal in my practice, because what I can do is I can plug in the information into their system. Basically, you plug in all your diagnostic information, and this is just a graphical representation of some of that. And what you can do then is you come out with, this patient's a level 1, this patient's a level 2. I call them type 1 through 4, but that's basically where you can go. Once you've got your person into a level or a type, 1, 2, 3, or 4, this is where this gets very similar to Invisalign. I love Invisalign from the standpoint is that you do your diagnosis, you get your idea of what it's going to look like, and then you order your aligners. Well, at each appointment, when you get those aligners, it says deliver these aligners, do this, this, and this to the teeth. That's one of the most efficient ways to manage orthodontics, not just kind of go in there and look and say, oh, what are we going to do today? You know exactly what's going to happen, so you can not only manage your time, you can manage the doctor's time. Well, TruDenta has done something very similar. For each one of those levels that you saw, they've created a defined treatment protocol. So each one of the levels has a defined treatment protocol, meaning it tells you how many appointments, how long those appointments are typically going to be, and what exactly do you do at each appointment. What I mean is, what does the assistant that's running this program, 80% of the work that's done in TruDenta is done by the auxiliaries or whoever is going to be in charge. So it's typically by an assistant that is trained and able to do the therapies. They do 80% of the work in TruDenta. 20%, somewhere in these forms, there's a point where the doctor needs to come in and do a delivery of an appliance. TruDenta absolutely uses appliances throughout the treatment. It's not used after the treatment necessarily. So they don't condemn a person to wearing a piece of plastic for the rest of their lives. We want to get to the heart of the problem and complete the patient's problem, not just keep giving them something to crutch on. So that's what's amazing. So you'll see that level 4, they'll have a fair number of appointments there. There could be in level 3, 10 and 12 appointments in level 4 that the patient must go through to get to the ultimate success. So I'll talk about some patients that weren't successful in my practice and why they weren't. And you'll see they won't make it through all these steps. But that's what's amazing about this system is it's so well orchestrated for the flow of your office. So it's finally a system where not only can I diagnose correctly, because that's half the battle, but once I get diagnosed, I have a protocol to follow to get that diagnosis corrected. And that's fantastic. So what do you do when you get this protocol started? You know, we looked at this form. In this case here, there's 12 visits that we're going to do, and there's a bunch of stuff to do at each visit. The time is generally laid out. I think these times are longer than what they normally are because what will happen is you'll get more efficient and you'll get these things done. But the assistant's going to use a various number of pieces, tools, if you will. And there's a bunch of equipment that's been optimized for TruDenta. So we have a cold laser in the upper left. There's some trigger point activity work that needs to be done on the lower left. There's some stimulation that has to be done to increase blood flow and get things happening, and almost like a TENS action, if you will. But we don't use tensing like traditional tensing that you see in other things. We definitely want to get some electrical stimulus. What does that electrical stimulus do? Well, it's an intense deep stimulus that will actually help the biofeedback loop to be created in the brain. What does that do? It doesn't do anything more than get the blood flowing and release of endorphins in the brain, which is like natural Motrin flowing through the system. So it's a way of having the patient treat themselves indirectly, meaning you get the right components flowing. And then ultimately we want some deep therapy, not only with the cold laser, but we want some ultrasound therapy that's been modified and the system set up for dentistry. Also, the little handpiece that you see there has been modified. Usually the ultrasounds are quite large. And these ones actually have been put together so we can use them in dentistry on the head and neck region comfortably. There is a homework component. And this whole kit the patient gets along with the instructions. And so there's some cold therapy work. There's some supplement work there's some supplements that the patient takes actually. And, MSM has been around for a long time. So it's not something that you're going to get any problems from the patient related to that. So it's been well documented how that works. It's a nice, natural anti-inflammatory. And that's what it works. Instead of putting the person on, amounts of Motrin or ibuprofens or meloxicam, or steroids, we're going to use something natural here in combination with several other things that the patient's going to do with regards to home care therapy. And this is critical for a lot of the levels of this. You'll see a TENS unit there, that Micro 2. We use micro TENS current. We don't use tensing. They're not going to be tensing their muscles till there's involuntary movement of their jaw. They're going to actually be sitting there having a deep microcurrent put into the muscle. Why? Blood flow and endorphin release. So we don't need to pulse the muscle. It's not a neuromuscular approach, as I told you before. Once we get through those steps and we're putting the patient through all the different therapy steps, then we can evaluate. In my practice, and this was some of the early data that we got, we did about 74 cases. You could average that out over the first 18 months, about 4 a month. We had 2 failures. And the 2 failures, one patient discontinued therapy, meaning she got through 3 or 4 visits and she felt great, so she said, I don't need any more. Well, about 6 months ago, we actually started that patient over because she had a relapse because she didn't get through the entire treatment. One patient we stopped working on because they were simply non-compliant. They wouldn't do any of their home care. They wouldn't do any of that kind of stuff. And so we just basically stopped the therapy, and we have that in our work that we can do that to a patient. It's interesting. In the dental world, once we started telling patients that we do this and that we do these kinds of things, we found that type 3 patients, which are the ones that have the dental tension headaches with muscle imbalance and interferences, that's where most of the patients fell in. So it was well within our scope. We had about 20% of the patients that were in the type 4 that had a true migraine related to postural position, physical problems that we really helped. But we saw more of those that were in that dental because they recognized that. So again, remember, why did I get into TruDenta and TruDenta? And there's a lot of things. I was looking for something, as I told you, to develop my practice. I wanted to obviously better care for my patients. I really was in that rut of treating all the patients the same when they really weren't all the same. And I wanted to increase my business. My accountant, Murray Novi, said something to me. He goes, look, you're not buying any more equipment. You're not buying any more of this kind of stuff because if you have to do it, you can't handle anymore. You can't do physically any more than what you're doing in your office right now. And he said, so, why get into more? You're just going to leave something that you're already doing and making money. And he also says, I'm that Jewish mother. He looks at everything I do. He looks at every penny I spend and what the return on investment, and it's been good. He's not a practice analyst of any kind. He's just a good old accountant looking at what I'm doing. And so we kind of looked at what was in my office, and when I wanted to get into TruDenta, I explained. He said, well, how's that going to work? When you're busy doing drilling and filling or whatever you guys do there with your tools, how are you going to do TruDenta? And when I explained to him that most of TruDenta is done with an auxiliary, then the light went off in his head. And we looked at my office and we looked at my schedule, and he said, why is this column, each column represented a chair, why is this one column always empty? And I said, well, I can only be in one room, and I got a hygienist in another room, so I've got this kind of backup room that is not being used. And so we found that office, that chair, on average, about 12 hours a week at least, was totally empty. So we had $50,000 worth of equipment sitting in a room that we weren't using. We weren't getting any return on investment. So it was really an opportunity that if I was busy in the other room, I could get a production from a staff person, like an auxiliary. I didn't have to have a hygienist in this. In fact, I didn't want a hygienist because they're too expensive. And I wanted something that other room could be filled and making profit for me. So did TruDenta really increase our production? Sure. We did those 74 cases in the first 18 months, and what we found was we generated about $270,000, which was an average of about $15,000 a month, which on top of what we were doing was fantastic. And so when I looked at the cost of the system, which is around that $70,000 mark, and then I realized I needed that assistant that was going to be working on TruDenta pretty much all the time, I said, okay, well, I'll take their monthly income, put what I'm paying for TruDenta in that, and then I kind of looked at what my production was. So my cost of the TruDenta in the office was about $4,500 a month. But I was making 15, so I had a profit on that of about $10,000 a month, which was great for me, utilizing that space. Now, at 24 months, we did a lot of marketing in the first year. We didn't see as many cases after that next 6 months, but it kept steady. So what we could find out, though, is, what did we make over the 2 years? So when you look at all of our production, we did about $327,000 in TruDenta over the 2 years, which is about an average of $163,000, $64,000. And so that was great because, the average hygienist will do $150,000 to $200,000 typically in an office. So we were getting that same production, but without the cost of a hygienist. And in the last 12 months, we've really done almost zero marketing because everything we did at the beginning has kept the flow of our system going where we want it to be. We can't do any more physically right now. So we keep things going. One of the huge things that I really didn't put together, I knew I was going to get these patients if I let people know that I was doing this. I knew I was going to get new patients coming in for TruDenta. I just didn't realize the huge side benefits of TruDenta. Just the sheer amount of dentistry that we needed to correct in order to get people to have stable bites. Part of the problem is force management. Stable bites and force management was a big deal. So taking cases like this, from these old nasty restorations into something that was not only cosmetically beautiful, but worked and functional. We actually found out that we were doing about 4 times the production off of TruDenta patients in restorative and orthodontics. So we were doing well over the $400,000 mark as an offshoot of what we were doing for TruDenta. So the amount of, bread and butter dentistry, if you will, was huge. And I had no idea it was going to be that large when I first got into this system. So are there patients out there? Are we ready to treat it? Yeah, we can handle the medical. We can handle those therapy, components. We can handle the dentistry. And there's patients out there that, we really, really can get a lot of patients that don't know where to go. They don't know we can treat this kind of stuff. So if you look at my practice and where I was going, trying to get patients, I did all kinds of stuff. I'll mention this right now, but when I first got into the system, TruDenta didn't have any help with marketing really at all. Now it's phenomenal what they can do for you with helping you lay out ads and brochures and doing direct marketing. Because here's the deal. You have to let people know that you're doing this, and they'll come. It's one of those things. But if you don't let any, there was a guy in California I ran into that was a TruDenta office, and he goes, yeah, it's working great for me, a great success, but I'm not doing very much. And I said, well, what are you doing for marketing? What are you telling people? He goes, I'm not doing anything. I go, that's kind of like a, a common sense thing. If you've got something new and unique, you need to invest in and let people know that you're doing it. I'll tell you where our patients come from. We had 0 from general practices, 0 from other specialists, 0. 20% of our patients come from our patients. Internal, referral. That's pretty common, I think. 45% of our patients come from ENTs. That's one area. Now, we don't do a lot of neurologists and different people like that because they're busy doing medicine. They treat. But ENT people will see patients that kind of complain about problems. They'll say, no, you don't have any sinus problems. You don't have any ear problems. You got TMJ. Go see your dentist. If your dentist doesn't treat this, go see this guy. He's treating. So we did a fairly large marketing campaign just to ENT offices. And we gave them brochures that were custom made about ours. We did some lunch and learns. We did some other things. And we really got the attention of those offices, and we get a nice referral. I'll talk more about that in a bit. 35% of our patients come from direct marketing. This ad we've put in several different, advertisements in different journals, in local, newspapers and chronicles in the area, to citywide type things, and we've got a lot of patients. This ad in one of the magazines called Houston, if we put that in that, we'll get over 100, 150 phone calls, which I told you my office is a 3-chair office. It's got a small staff, small front office staff. When you throw 150 phone calls on top of them, it's overwhelming. So you can get the patients, you just have to be ready for them. And so this is an example. This is all, TruDenta has all this kind of stuff that they can help you with now. So I used to have this list of questions people used to ask me about, the office and how it's been in my office and those kinds of things. I've told you about the financial results. I've told you about the, patients coming in, things that happen as an offshoot of there. But there's about 20 questions now where I kind of hopefully will answer it. And the number one question I get to people after is, I can't figure this thing out. Well, I tried in my own words and what I think it would be to tell you what I think TruDenta is and how it works and what it'll do in your practice. I will tell you that when I first started looking at TruDenta and talking to the salesperson, I asked them flat out, I said, what are you selling? The smoke or the mirrors? Meaning it was like magic. It wasn't really, because I have several things in my office that I purchased from previous types of things that were supposed to be great, and they're just collecting dust, and I'd love to get rid of them. But this actually works. The success rates are there. So I'll tell you what it is. It's a system where you can finally diagnose these patients with joint problems, headache problems, muscle-related problems, bite force problems. You can actually diagnose them, categorize them, and then you have a treatment protocol. TruDenta gives you all the components you need to treat these patients and what the expected outcomes for each types of patients and the protocol and how long it's going to take. Then you can figure out what it's going to what you can charge in your office. You saw some of the numbers that I charge in my office for the different levels. And I'll explain more about that as we go through, but it works. Why is it so much money? Well, there's a lot of pieces of equipment, and there's a lot of technology that you're going to get, and a lot of components part of the system, and the support mechanism is phenomenal. So once you get the system and recognize what you're getting, the whole package put together, and all the different things that you're going to get, that's where all the cost comes in. So it's an easy return on investment once you see all the stuff that you're going to get with this. How do you market it? And what does the company? I told you at the beginning, the company never helped me much at all. But now they have all these different components to help you do, whether you want to do lunch and learns, direct marketing, external marketing, internal marketing, whatever you want. There's lots of components that they now help you with and have basic things that they can get done for you to get you up and running and get your office doing in this. Other dentists tell me, my patients don't complain about headaches, so why do I need this? Well, we don't want to get lumped into just headaches. Headaches are a broad spectrum. Any kind of head and neck pain, anything that is related to the occlusion, skeletal problems, functional problems, all those things all lumped in. And that's why TruDenta has 4 different levels. Ultimate one being level 4, which is going to be those patients with the extreme headaches that are typically called those migraines, those more than 10 or 14 times a month, and they're popping Motrin all the time. It definitely can treat those, but it also can treat a magnitude of other different levels that aren't necessarily always at that headache. So have you ever asked your patient, I always ask the dentist, have you ever asked your patient if they ever get any head and neck tension type headaches? Well, they don't. They very rarely do. So start asking your patients. Does this system diagnose joint problems? Indirectly, it does. All the signs and symptoms that you're going to diagnose with TruDenta are going to definitely be reflective of problems that are going on in the patient's joint. Internal derangements are great that you diagnose them if you want to, but what are you going to do about them? It's all the coping mechanisms and all the coping compensations of the muscles and how they're stabilizing the body and stabilizing the bite is what you need to manage. If I told you that a patient had an internal derangement that was a perforated disc, or if I told you that they had an anterior displacement with reduction or an anterior displacement without reduction, what would you do different? Well, TruDenta incorporates that into their program, into their therapies, because if they fall into a level 4 or they fall into a level 3, there's a good likelihood that they may have early joint degeneration, meaning DJD, degenerative joint disease. So we know that if they have these signs and symptoms, there's a good likelihood. So they're all put into the comprehensive care system, but knowing a definite diagnosis of each one of those is not necessarily going to change the protocol of treatment. Where do the patients come from? I told you, a lot of them from ENTs, a lot of them from direct marketing, and we're getting more. And I told you now, it's interesting, because I told you that we're not doing much marketing in the last 12 months. Well, where do the patients come from? Our early marketing helped a lot. But we have an amazing element now on our website, which TruDenta developed through Sesame, which you can put onto your website. And so there's a module that you can get about TruDenta to plug into your current website. And if you go to my website, which is ritscosmiles.com, www.ritscosmiles.com, RITSCO smiles.com, you can go see what we put in there. So the majority of our patients now that we've seen lately have said, I read about this on your website. I've seen all the stuff that it can do. I actually was linked to the main company's website. There's a patient portal for the main company's website that they read a lot, and they said, this is what I need. I've gone to the doctor. I've tried these different drugs like Imitrex and different things. And guess what? If they're not a chemical imbalance or an environmental imbalance, these medicines that they're putting into their system aren't going to help. There's a physical element now that's triggering the migraine or triggering the headache. And there are always triggers that happen. They don't have to have a migraine with an aura. They don't have to have these different things. So migraine is a broad term. But they do come, so the website's been phenomenal for us. How much time does a doctor take and how much is done by staff? I told you about 80% is done by staff. So what we do now is we see our new patients on Thursday afternoons, and we do therapies on Fridays because I have more space available on Fridays. And so they'll do 6 or 8 patients on a Friday, and they'll just rotate through as they go. And I can do either lab work, I can see a patient on my own, or I can do office work. And they just need me for small amounts of time. So I'm not sitting there having these long discussions with patients like I used to, going around in circles. They're getting the therapy done. They're walking the patient to the next program. Here's the next appointment. Here's the next interval. Make sure you're doing your home care. A lot of times I don't even see the patient. They're just moving through and just getting a report from the staff. So it's really easy on me now. It's really easy on me. There's a book, and it's this complicated title here that you see. This is a book that I think explains everything with incredible detail. But it's a book that needs to be read at some point when you become a TruDenta user. This will explain everything that you're doing and a lot of the background information, because we always like to have stuff backed up by some sort of scientific information. Where does this come from? What's happening? And this is the book. So you can read the book before you get into the system, but you should be an active user, and this book will really be a useful tool for you for not only what's going on, but having discussions with patients. So I'd leave that. Can I bill medical insurance? Absolutely. In Texas here, we do pretty well. If a patient's a type 3, I charge $4,200. I would say that we get around $3,000 of that from medical insurance. So the patient's never out of pocket that much. You've got to bill each appointment individually. The only challenge we find nowadays is there's some pretty high deductibles, but we send everything that we do for TruDenta to their medical, so it goes towards a deductible. So one way or the other, the patient's happy about the effect that it can have on medical, or they get some medical some support with their treatment. So that's been pretty successful. We use our own software. but TruDenta's recognize this, and they have a pretty neat software system now that I think will walk you through the medical billing, because it's not something that we're necessarily all that dialed into as dentists. So you need some help sometimes, and they have the tools for you as that as well. How long does it take to get the system up and running? Well, I'm telling you from my personal standpoint, it took us probably 8 weeks. And what we found was that we needed to be trained, we needed to play with the equipment a little bit, try it out a little bit, and then do some mock patients and do some patients that we knew that we could work on with, that we knew in the practice already. And then we were ready for the patients at large. We didn't look like we were just using it for the first time, but it did take a little bit of time in our regular, day. Are headaches the only thing that can be treated by this? No, it's one of the elements. It's the ultimate treatment, but there's 4 different levels that are before the severe headache type patient that you can do amazing things with a patient to get them ready. I had a patient that was a full mouth rehab, a couple of them actually, and I felt like with my rehab, I got them 90%. They still had muscle compensating issues. They had muscle tenderness issues, and with the TruDenta, I actually was to get them relaxed enough and out of pain, out of discomfort enough to make my final equilibrations on them and get them to a point where they're very comfortable and not relying on plastic to hold them together. What was the best thing about it for me? I think I mentioned this earlier. That diagnosis leading to categorizing the patient into a level 1, 2, 3, or 4, then ultimately someone putting together something that I can follow, that I don't necessarily have to be the leader all the time. Here's a defined protocol. Let's walk you through this, and if we do this right and you do your home care right, we're going to have great success. I think that's amazing for my office. It's an amazing flow system that you can put into your office with ease. What does the company do for you after you get a system? Well, I think it's a better time to get into the system than when I did. The marketing support, the training, they've simplified the system. The equipment has gotten much better since I got into the system. It's been more user-friendly for the dental office. They've modified some of the equipment as I tell you, and really, the system is so easy to learn that you're going to have probably one assistant that is going to take over for this and be excited about it. And I think that they'll help you train, and that's one of the big deals. It's a modular training thing you do online, then ultimately you do it with them. And they do hands-on, side-by-side, to make sure that your person who's doing the therapy is real comfortable. I get this question, I got to have a special room. I told you I have 3 chairs in my office. I don't have a special room. Every room is the same, basically. And at the end of the day, I don't have any more room. Now, there's a guy in Dallas who made a beautiful, TruDenta spa, and you can do that, but you don't need anything special. You don't need there's a cart that you roll in and you do your TruDenta treatment. How much can you really make? I hear people saying, you can make millions of dollars with TruDenta. I think you can do really well with it, meaning if you have one system and you have a person and you have some time in your office, you could probably do that $150,000 to $200,000 a year with the system. But the bread and butter that you're going to do off of this with orthodontics and restorative work is going to be huge. You will get, and I will tell you, I've gotten more new patients that are good patients, meaning they're not only for TruDenta, but they're patients of our practice, and more return on investment than any other marketing thing that I've ever purchased. And so this is actually a treatment program that you can actually market. It's fantastic that way. So it's there. Will the patients feel better after one treatment? The company says this. I don't believe it. I think that it takes 3 or 4. Some of these patients are really, really tangled up, and they need to work through a couple therapy protocols before they can get fixed. So I don't see a lot of that, but you can try it. Some patients claim that they have great resolve after one treatment, but that's not been my experience. What kind of things do you do to motivate your staff? Well, I'll tell you right now, I don't want this to gather dust. I needed to make sure that it got paid for and that it made production. So my staff gets 20% of all the production, which is probably a lot, but they love their TruDenta checks, and they would do TruDenta 7 days a week if they could, But we limit it, and we limit it to basically all the different things that we do in the office. But we do it, like I told you, we have defined days that we do it on, and they love getting their TruDenta checks. How many TruDenta patients do you see in a month? I will tell you, I don't see a consistent number every month. I'll see sometimes 12 in a month, and sometimes none, and sometimes 1 or 2, but they average out over the year. And it's just the flow of how patients come in. At certain times of the year, they seem like there's more problems than others, and it also depends on what we're doing to market. I call it shaking the trees. And we're probably ready to shake the trees again with TruDenta pretty quick here to make sure we have a flow. We're getting to the end of some of our TruDenta patients in therapy, and so we're ready to get some more patients in the office. How much of the system can I write off? Well, I mean, the company can tell you more, but I believe that we did a 179 write-off, Section 179, and most of everything in the system was the write-off for us. So that was nice. That was a nice thing to have. How much will you have to spend on marketing? Well, my general rule of thumb is I spend anywhere from 10 to 15% of what the system costs. So you can spend $7,000 to $12,000 in a period of time in a quarter, and your return will be huge for that. But you need to let people know. The bottom line is you need to figure out what's going to work for you, and you need to let people know, that you're doing this or you're not going to be doing it, as I mentioned to the other person. I want to finish up with a couple little things. This is a guy that his name is Bud Adams, and he used to own, or he still does. He owned the Houston Oilers, which are now the Tennessee Titans, but he owned a lot of car dealerships and oil industry things and all kinds of stuff. And I just said to him one day, look, you're a patient of ours, but I want to know what the silver bullet is. I want to know what I need to do to make the money like you do. He's telling me about his, $25 million planes and all the different things that he has, and said, I need to know what to do. Just tell me the one thing. He goes, the one thing that I can tell you that is most important, he goes, you've got to try new things. And trying new things can be very, very successful for you. You don't risk the family. You don't risk the family, college fund. But you try things that you feel are going to be better for what you're doing. And the last thing he told me was, you've got to get into something where you're just not doing it yourself. You got to get into something that other people are working for you and making money for you. And this is probably one of the first areas I found in dentistry where it's not just me hunched over the patient, that I actually can have a team working to treat patients and come out of it with a nice profit and not me just grinding away as usual. So it's basically something there. I put in some corny slides, the power is in the palm of your hands kind of thing here, but it really is. I mean, you can make of this what you will. There are patients out there that really need this therapy. You just have to let them know that you're doing it. So I want to thank you all for coming in, and this a little bit later for me, but probably earlier for some of you, maybe on the West Coast. And I had some great times there last week and doing some surfing in Huntington Beach, and I know there's a few people from California on here tonight, but thanks again. I'll take some questions right now. I just put this on here. I didn't have it. I didn't want these presentations for them earlier this evening, but they have some great resources on this website. If you don't know this website here, drsdoctor.com, I hope I put that on there right. And then their phone number. Again, they've got a lot of people that can probably answer questions as well as I can, but I can probably answer for you more so about the everyday use of this in the practice and kind of how long it takes to get things going and whatnot. So I'm going to end there, and I'm going to say, probably there's some questions that maybe we can take. Scott, if you're still on the line, maybe we can help with some question monitoring. And thank you for your attention. I hope I got the point across what I think the TruDenta system does for me and what it is. I know the company has salespeople that go out there and try to explain it and do all this stuff. It's just my take on what this does and what this is from a practice. So I hope you enjoyed it. I had fun, and Scott will take some questions if there's any.
Yes, we've got a question tonight. Question is, can you provide a bit more information regarding how you handle the medical claims? Does your office file them as they do dental claims, or do you provide the narrative for the patient so they can file it with their insurer?
Oh, no. It's really simple. We have a little software that we use, and as I mentioned, TruDenta has a software that they can provide for you that basically helps you to put together the medical claim form to send it into the insurance company. There's only been one occasion in the whole time that I've ever used TruDenta where we've had to do a narrative. So it's not a lot like you see in sleep dentistry and some of the other things. We're billing for each appointment, and we're billing for a defined therapy. And so those therapies are covered with not a whole lot of narrative. It's not a life and death kind of surgical procedure. They're all relatively small dollar pieces. And I mentioned that we'll bill, each time the patient comes in, and we'll get, $250 to $350 for each one of those visits from medical. The rest is out of the patient's pocket. We charge 50% at the beginning from the patient, and the rest we bill to medical, and then the balance to the patient for each appointment after that. And so we haven't had any challenges from medical. The only challenge we've ever had was just getting over these huge deductibles. And here's a side note. This is different. Medical is different than dentistry, obviously. And you fill in the form. As long as the form is filled in correctly, it won't get rejected. And these softwares, and that's another thing TruDenta has that they didn't have when I got into it. They actually have a medical billing software for TruDenta that will help you get through all this. So it'll make your life very, very easy. On the flip side of that, we send this stuff into the medical insurance, and we get really really good response from them. And we've been doing this now for quite some time. The form just needs to be filled in right, and 99% of the forms, if they're hand filled in, they'll get rejected because they're all scanned in by the companies. Just little things like that will be challenges for you that we learned the hard way. But yeah, medical billing's been relatively easy. We use a small software that we can talk to you about on the side if you want, or we can actually go ahead and you can use the software provided by TruDenta, which is going to be something that I think you're going to find that's really easy. And those that are doing sleep dentistry and some of the other stuff, you can use that software for that. That will help you as well if you're getting into that. So yeah, that's how we do it. And again, love to chat with you privately if you ever wanted to about that. Any other questions?
I don't see any other questions coming in.
Okay. I tried to answer all those in that 20 question section at the end there. That's kind of a common thing, and some people just forget what they want to ask. But I hope that I covered everything sufficiently for everybody, and really hope that if you're interested in it and you want to chat more, you can always get a hold of me, through the TruDenta people. I'm happy to chat with you and give you more information on that. So again, that's my outlook on TruDenta and what it's brought to my office. It's been no regrets whatsoever, and I'm happy to be part of a system that actually works. So that's been good. So thank you so much for your attention, everybody.
Thanks, Dr. Ritsco, for your time tonight, and we really appreciate you spending time with us and sharing your thoughts on the TruDenta program and the TruDenta system. And thank you, everyone, for attending, and have a great night.
Great. Thank you. Bye-bye.